Greetings, fellow North Carolinians. Thank you all for joining us here this morning. My name is Quinn West Godwin. I serve as the Central Regional Field Coordinator for the 75th Governor of North Carolina, Governor Roy Cooper, in his Office of Public Engagement. Governor Cooper, along with Cabinet Secretaries, agency staff, and thousands of state employees, have been working nonstop to fight this pandemic and help the people of North Carolina get through this tumultuous time, now in the midst of an active hurricane season. Our purpose in these engagement sessions, of which we've had about 14 since March, is to have multidimensional information sharing to make sure that we are available, transparent, equitable, and connecting with all North Carolina communities during this crisis. Yesterday, Governor Cooper announced that North Carolina will remain paused in Safer at Home Phase 2 for 5 more weeks, reaching into September as students and staff return to schools, colleges, and universities, and the state doubles down on efforts to decrease COVID-19 numbers. Face coverings are still required when people are in public spaces. Today's program will focus on these updates and a lot more. Just like our previous sessions, we encourage you to engage with us via the YouTube stream chat and the WebEx stream, where you can send questions in real time. During our program today, we will hear from Mr. Benjamin Money, Deputy Secretary for Health Services at the North Carolina Department of Health and Human Services, Ms. Caroline Farmer, Director of the Office on Volunteerism and Community Service, Secretary Michelle Sanders of the North Carolina Department of Administration, Mr. Bob Coates, Census Liaison for Governor Cooper, Ms. Tammy Hall, Director of the North Carolina Office for Historically Underutilized Businesses, or HUB. And lastly, Mr. Jeremy Collins, Director of the Office of Public Engagement, will address added concerns sent today and close our session. Again, thank you all for being with us this afternoon. I now invite Deputy Secretary Benjamin Money to the stage. Thank you.
Thank you, Quinn. Provide an update on COVID-19 in North Carolina. There are currently 1,147 people in North Carolina's hospitals with COVID-19 and 333 in the intensive care units. Sadly, since the start of the pandemic, there have been 2,050 individuals in North Carolina that have lost their lives to this disease. We mourn their loss and we pray for their families. Nationally, there have been over 158,000 deaths, including 11,100 yesterday. But as we see viral transmission levels start to stabilize here in North Carolina, across the country and around the world, many places are experiencing the opposite, trends that are going in the wrong direction after rushed reopenings. In North Carolina, we continue to take a measured approach, making decisions based on the best available data and scientific evidence. As I've said before, and as a reminder, we use a combination of metrics that we look at over a 14-day period to make our decisions. Some of these indicators help us understand the rate of viral transmission in the past few days, while others, like hospitalizations, tell us how much transmission was happening a few weeks ago. So, first indicator is people that come to the emergency room with COVID-like symptoms. What we're seeing is that trend is declining. This is a positive step, but the numbers are still high. Our second indicator is lab-confirmed cases. We are starting to stabilize, but the rate of new cases, again, is still high. Of note, yesterday, while conducting data quality monitoring, we identified laboratory reporting omissions for August 2nd through 5th. That corrected data for the new cases and the percent of tests that are positive will be posted in today's update that'll be on the website around noon. Our third measure are positive tests as a percentage of total tests. That is, the total percentage of tests that are positive is generally going down, but it's hovering close to around 8%. I shouldn't say going down, it's actually level. We still want to see that number and that percentage go down to 5% or less. So right now, 8% is still too high. And then our next indicator is hospitalizations, and that's day-over-day hospitalizations. That means people who are going into the hospital today were likely infected days or even weeks ago. And North Carolina's growth of hospitalizations is beginning to level off. Fortunately, we still have adequate hospital capacity here in North Carolina, and we continue to monitor capacity levels very closely. We also track some critical capacities that measure our ability to respond to the pandemic. The first one is testing. And while our testing turnaround times have improved, we've seen fewer tests done over the past week. Some of that has to do with weather and the hurricane, but also I want to just encourage anyone who wants to get a test to get one, particularly those who may have been to a large gathering or work in a high-risk job. There are many sites across the state that provide free testing. I encourage you to visit our website, www.ncdhhs.gov, to see a list of community testing events, including those the state has deployed to increase access to free COVID-19 testing for historically marginalized communities. Our next measure is contact tracing. That's a critical capacity for us, and we continue to hire contact tracers to bolster the efforts of our local health departments to meet their ongoing need. And then our third critical capacity is personal protective equipment. While these supplies remain stable, we continue distributing PPE across the state, and we distributed more than 3.5 million cloth face coverings, 4.4 million procedure masks, and a significant amount of personal protective equipment to support facilities that conduct essential public functions, including schools, child care facilities, courthouses, and other settings with higher risk of COVID-19 transmission, such as nursing homes and agricultural facilities. We are seeing stabilization of these numbers, but we can't afford to let our guard down. This stability is fragile, and these trends can change very quickly. You only have to look at the hospitals and other states that have been overwhelmed to see what happens when reopening occurs too quickly. As I reminded you before, North Carolina, we've used this dimmer switch approach to easing restrictions. This has ensured that we've not opened too much too quickly, which many health experts and what we've seen across the country shows can lead to a devastating increase in cases, sickness, and death. In addition, it can lead to us having to go backwards, as we've seen in other states. So in keeping with our dimmer switch approach, with schools opening and the push to decrease our numbers, which will keep people healthier and boost our economy, the governor, as Quinn mentioned, announced yesterday that North Carolina will remain paused in safer at home phase 2 for 5 more weeks. Experts also believe that our mandatory mask order stabilized numbers, and just last week we added a curfew on alcohol sales to keep restaurants from turning into bars, which are high transmission areas. So please keep wearing your face coverings and practice the 3 W's. That's waiting 6 feet apart and washing your hands. These are difficult times, but these difficult times won't last forever. The more we all practice these simple but important safety measures, the faster we'll be able to recover as a state. I want to thank you so much for your attention and your support.
Hello, I'm Pryor Gibson, Assistant Secretary for the North Carolina Division of Employment Security, and I was asked to give you a brief update on unemployment insurance. We have seen a tremendous surge in claims for unemployment benefits due to COVID-19. I want you to know that we're working hard every day to resolve claims and deliver benefits to people who are eligible for them and who need them. During the COVID-19 pandemic, we have paid out more than $6.7 billion in unemployment benefits to folks across the state. These payments are from the 5 different programs the Division of Employment Security has been running. The first is the State Unemployment Insurance, or UI. This is the state's regular unemployment program that provides up to 12 weeks of benefits. Then, There are the two federal programs that provide extensions to the state unemployment insurance: Pandemic Emergency Unemployment Compensation and Extended Benefits. Then there's the Pandemic Unemployment Assistance, or PUA. This program is for those folks who are ineligible for state unemployment insurance, such as independent contractors or self-employed workers. The last program is Federal Pandemic Unemployment Compensation, which has now ended. This was a federal CARES Act program that provided an additional $600 on top of a person's weekly benefit amount. Payments for weeks after July 25th will not include the extra $600 benefit. We are watching closely and will keep you updated if there are any changes to the benefits that are available to the people here in North Carolina. Since March 15, more than 1.2 million North Carolinians have filed for unemployment. Approximately 69%, or about 840,000 people, have been paid benefits. 23%, or about 280,000 people, are not eligible for benefits. 5% are not approved for state benefit, but their claim for federal benefits is pending a resolution. And 3% have a claim for state benefits that is pending a resolution. Many of these pending claims have issues that require individual time and attention by experienced staff to resolve. So, DES established a dedicated team of experts that focuses on claims that were filed earlier in the pandemic. We continue to make good progress on clearing the backlog. Every claim is important, and we are working hard to bring every claim to a timely resolution. As we do this, we have another important responsibility, and that's detecting and preventing fraud in the unemployment system. Fraud can come in many forms, from identity thieves using your name and information to fraudulently file for unemployment, to claimants making false statement or withholding information when they're applying for benefits. If you suspect unemployment fraud, it's important to let us know so payments don't get into the wrong hands. You can call us to report suspected fraud at our new fraud hotline at 984-465-9224 or through the fraud reporting form available at des.nc.gov. On our website, you'll find much more information, updated data, and frequently asked questions about unemployment benefits in North Carolina. From all our staff at DES, thank you and have a great day.
Good morning. My name is Caroline Farmer. I'm with the Commission on Volunteerism and Community Service located in the Governor's Office, otherwise known as Volunteer NC. During a disaster, the Commission becomes activated as the lead agency for volunteer and donations. Both the pandemic and the hurricane this week have triggered that activation. In fact, on Monday, we activated the North Carolina Disaster Recovery Fund. If you go to the website, nc.gov/donate, you will see information about how to donate finances, information about what is needed, how you can help in other ways. We will be sending and updating that more as more information comes in from those locales that have been most affected by the most recent storm. Individuals that have suffered trees on their houses, who need tarping, who have flooding in their house, mucking and gutting needs, debris removal, mold remediation, can contact this number. It's for crisis cleanup, 844-965-1386. Again, 844-965-1386. The reason that we have this information is so that nonprofits can come and help with those things for free. We want to make sure that those individuals who have already suffered and have this damage get as much assistance as possible. So this is free services to remove the trees off the houses, debris, mold, and so forth. And as we go into long term, there will be volunteers needed for fixing these houses, for repairing. It will take years for each disaster for us to recover. We are still in the throes of Matthew and Florence and trying to do the repairs. So if you have the ability to hold a hammer, I would encourage you to go to the volunteer opportunity page at volunteernc.gov and go ahead and look for opportunities where you can help. Now, the pandemic is still going on. Feeding volunteers are still needed. In fact, Anson County just posted a need for their food pantry. So again, the volunteernc.org, under volunteer opportunities, you will see the opportunities listed for volunteers need. You can also sign up to get those directly into your email box. And I have to say thank you to AmeriCorps for stepping up this year. They ended their programs last month, and they were involved with delivering food to kids that could not make it to the sites that were offering food. They were helping at food banks, YMCAs with food. They were helping the homeless. And we even have an AmeriCorps program called MedServe that was in the trenches at clinics and testing sites for COVID, helping out. So a big thank you to them. Those folks are recruiting for this coming year, for next month. So if you know folks who are taking a gap year because of what's going on with the pandemic, for those people who are recently graduated and don't have a career path, encourage them to help their community. They get a living stipend, they get an education award, but moreover, they help their community. So lastly, schools are getting ready to start back. Be prepared. We're going to have a need for additional mentors, tutors to help with education. The way this is being played out, I just want to make sure that you know and keep checking back at the volunteernc.org website for volunteer opportunities so that you know about the education needs coming up. And on behalf of Governor Cooper, thank you very much.
Hello, my name is Katie Webster, and I'm the Assistant Director for Planning with North Carolina Emergency Management. I want to talk to you about putting together a disaster supply kit that may be needed in the aftermath of a disaster, such as a hurricane, flooding, or other event. History tells us that after an emergency, rescue workers and relief agencies may not get to everyone in need of assistance for several days. You may also have to evacuate and take everything you need to survive with you. Now is the time to get prepared by updating or building a disaster supply kit with non-perishable food, water, and other basic supplies for at least 72 hours. Most of the items you will need are inexpensive and easy to find. Don't forget supplies for your seniors or pets who may evacuate or shelter with you. Since spring of 2020, the CDC has recommended people include additional items in their kits to help prevent the spread of coronavirus or other viruses in the flu. Consider packing the following items into your disaster supply kit based on your individual needs. Several cloth face coverings for everyone ages 2 and above, soap, hand sanitizer, and disinfecting wipes, prescription and non-prescription medication, pet food and extra water for your pet, cash or traveler's checks, copies of important documents such as insurance policies, identification, and bank account records saved electronically or in a waterproof portable container, sleeping bags or other warm blankets for each person, complete change of clothing and sturdy shoes, feminine supplies and personal hygiene items, books, games, or other puzzles and activities for children. Remember to maintain your kit by keeping it in a cool, dry place and storing boxed food in a tightly closed plastic or metal container. Do not forget to replace expired items as needed and rethink your needs every year and update your kit. Keep your kit in a designated place and have it ready in case you have to leave your home quickly. Make sure all family members know where it's kept. You may also want to consider preparing smaller supply kits for work and your car. Visit readync.org to learn more about how you can prepare and plan for dealing with an emergency, including additional items to help build your disaster supply kit.
Good morning. My name is Latanya Patillo, and I'm Teacher Advisor at Governor Cooper. I want to share a little bit about information about school reopening for the fall. On July 14, 2020, Governor Cooper announced that all public schools should open in the fall under Plan B. Plan B is a hybrid plan that provides both in-person schooling options as well as options for students to engage in remote learning. It requires that districts increase social distancing measures and follow protocols that increase cleaning and sanitizing, both in the schools and on the school buses. This announcement gave school districts the flexibility to open under Plan B or Plan C, which is full remote learning. Since the announcement has been made, districts have been releasing their individual reopening plans. The state has provided all school districts with personal protective equipment to begin the school year, including 5 reusable face masks for students and educators. Districts are continuing to review their local health metrics. They're listening to their families, their educators, and their community members in order to make the decision most appropriate for them. As of August 4th, 64 school districts in the state have opted to open the school year with remote learning, with the opportunity to reevaluate their plans at a later date. As Governor Cooper has said before, he will continue to use the health guidance provided by NCDHHS and will consult with the State Board of Education to make any future decisions about school reopening. If you have any questions or want more specific information about the guidance provided to school districts across the state, visit Strong Schools NC Public Health Guidance at covid19.ncdhhs.gov/guidance. Again, that is the Strong Schools NC Public Health Guidance at covid19.ncdhhs.gov/guidance. Thank you.
My name is Michelle Sanders, and I am the Secretary of the North Carolina Department of Administration. I am here today to speak to you about an urgent matter for our state. As of Friday, July 31st, 41% of North Carolina households have not completed Census 2020. That's $1.6 million of 1.6 million households in North Carolina that haven't been counted, including more than 4 million people in North Carolina. The uncounted residents put at risk $7.4 billion per year for North Carolina for health care, education, highways, and community and economic development. It's critical that all parts of our state get counted. We're concerned about our rural areas lagging behind in the census participation, especially eastern North Carolina, where I was born and raised. That's where we have many of our military families, many of our underserved communities are located, and where so many have been hit by hard storms as recent as just this week. Together, we are experiencing extremely stressful and unprecedented times. Many of you are involved in other causes, you have jobs and responsibilities, and face critical obligations. But we cannot forget the influence we, as the state, have through the 2020 census. And we cannot forget that we only have that opportunity now until another 10 years. It has never been more apparent, it has never been more important for us to become our own advocates. And that includes all the ways we work to make our voices heard. Of course, by voting, but also by completing the census, which is everyone's constitutional right. With the 2020 census, we can improve the data that supports who we are as a community, who we all are, and make the facts undeniable. These duties to yourself, your family, your community, and your fellow North Carolinians will have an impact and make a lasting difference. North Carolina is the 9th largest in population and the 4th fastest growing state. And we need an accurate and complete census count for funding, planning, and services today and in the future. The census happens just once every 10 years and is the foundation for representation in Congress, planning and services for the next decade. North Carolina is projected to gain a seat in the U.S. House, and census data will bring $1,823 per person per year in federal and state funds back to North Carolina counties and towns. An incomplete count puts both the additional seat and funding in jeopardy. You can complete your 2020 census safely at home online at my2020census.gov or by phone 1-844-330-2020 in English and 844-468-2020 in Spanish, or by a paper form. It takes less than 10 minutes and it can help shape our future of this state for the next 10 years. Census workers will begin knocking on doors on August 11th in North Carolina to complete the census count. But we know that COVID-19 and hurricane season will make the task harder and will require an adaptation and adjustment to how we proceed. Now is the time for community leaders and trusted voices to encourage everyone in North Carolina to be counted in 2020. We need the help to ensure that all people, regardless of color, race, age, sex, family, or citizenship status, can participate in the 2020 census and have an equal voice. This is fundamental to our democracy. We are running out of time, and the state needs your help. Please let your voices be heard. Participate and complete our census. For more information on how you can help, visit census.nc.gov. Join each of us and join me in lifting voices to ensure that all North Carolina residents count, that everyone's voice is heard. It's safe, it's easy, and it's a quick way to impact our future, your family, your friends, for generations to come. Thank you for your participation, and thank you for caring deeply for the state of North Carolina and all residents here.
Thank you, Secretary Sanders, for those compelling and informative remarks. As you highlighted, there's a lot of confusion about the census, so let me address some of those main concerns. Despite recent and confusing headlines, everyone in North Carolina counts, regardless of age, race, sex, citizenship status. Everyone in North Carolina counts. There is no citizenship question on the 2020 census, and no individual data can be reported to any government agency, entity, law enforcement, your parents, anyone for 72 years. Title 13 of the U.S. Code protects your personal census information, and it is that federal law that is in place right now that guarantees that your information cannot be released for 72 years. Census data is only ever reported at the summary level. What does that mean? For example, you may hear that 10% of a town's population rents their home. However, the Census Bureau cannot say that the resident of 123 Main Street is a renter. That's the difference between an individual release of information and summary release of information. Your individual information is not reported again, and there is no citizenship question on the 2020 census. Now, this week brings another point of confusion. The COVID outbreak has impacted all of our lives, and it's also impacted the census operation. The U.S. Census Bureau extended the self-reporting deadline until October 31st. However, as of this week, that deadline has been shortened to September 30th, 1 month shorter. So we can't afford people to be confused and miss that revised deadline of September 30th. It's only 8 weeks away. And as the Secretary mentioned, we have 8 weeks to count the 4 million North Carolinians that have not been counted up to this point. By shortening the deadline, we risk $7.4 billion per year in census-driven funding for critical services and programs. It's also important to note that that census data, as the most complete picture we have of our communities, will help us recover from storms like we had this week and from the COVID pandemic. So by being counted in the census, you are helping your community and your future to handle storms and also to develop programs to address a growing population. We also risk an accurate picture of all North Carolinians and where they are. The data about our population impacts funding, planning, and services for the next 10 years. So we need to know who you are and how those best decisions can be made to serve you going forward. As Secretary Sanders also mentioned, North Carolina is in line to gain a seat in the U.S. House of Representatives. But that expanded voice for the people of North Carolina only happens if all of us, every one of us, from the oldest to the youngest, are counted in the census. Now, we also want, in this environment of COVID, that we also want North Carolinians to know that you can avoid the knock. As Secretary Sanders mentioned, starting on August 11th, census workers will begin going door to door to count the non-responding households. Now, it should be pointed out, in the era of COVID, all those census workers will be wearing personal protective equipment. They'll be wearing masks, gloves. They'll have hand sanitizers. They'll be observing social distancing. They will not enter households. It's important to also note that those census workers will only be asking the 10 basic questions from the census form. They will not be asking for your Social Security number. They will not ask for account numbers or money donations. They will not ask for any donations on behalf of any political organization. And there is no citizenship question on the 2020 census. However, if you would like to avoid talking to a census worker, if you would like to avoid that knock on your door, you have some simple things that you can do. You can visit my2020census.gov and be counted right now. You don't have to wait till August 11th, and you don't need to wait till September 30th. You can also go to your phone and dial 844-330-2020 to be counted over the phone. Responding before a census worker comes to your door ensures a more complete count, and it is also the best way to avoid in-person contact during a COVID outbreak and meet your constitutional obligation to complete the census. And finally, the 2020 census is easy. It's 10 simple questions. It only takes 10 minutes, and those 10 minutes can shape your community and the future of our state for the next 10 years. So thank you for this opportunity to share some information about the 2020 census. Please make sure you make North Carolina count before September 30th. Thank you.
Good morning. I am Tammy Hall, and I have the awesome pleasure of serving as the Director of the Office for Historically Underutilized Businesses in the Department of Administration under the leadership of Secretary Michelle Sanders. Director Collins, thank you for the opportunity to share with your listening audience resources that are available to small businesses, minority businesses, and women-owned businesses. It is no secret that these businesses are the lifeblood of the economy, the engines driving prosperity in our communities. For these reasons and many, many more, the Hub Office has been really happy to partner with the Small Business Administration North Carolina District Office. For 8 weeks, we did educational webinars relative to COVID-19, the CARES Act, and how those resources apply to small businesses, whether that was the EIDL loan or the PPP loans that were available. If we have businesses that are still interested, there is capacity, there's availability for those loans. The Hub Office has also been most happy to partner with the Golden Leaf Foundation and the Rural Center. We hosted a number of webinars to educate small businesses on the funding provided by the General Assembly and Governor Cooper for low-interest loans through the Rapid Recovery Program. Today, I am most excited because we're kicking off 8 weeks financial wellness boot camp for entrepreneurs. If you're interested, we still have availability. On tomorrow, we will kick off another webinar in partnership with the Department of Commerce as we talk about the Retention Job Grant Program and how that applies to small businesses. We have availability for that webinar as well. And finally, on next week, we are hosting a webinar with the State Property Office focused on our real estate professionals. These webinars and much more can be found on our website. Our website, www.ncadmin.ncgov/businesses/hub. Director Collins, thank you for the opportunity, allowing the Hub office to participate. Have a great day.
Good morning. Thank you all for being with us this morning. And before we start, I just want to thank all of our presenters today, Ben Money, Caroline Farmer, Secretary Michelle Sanders, Bob Coates, and Director Tammy Hall. Thank you all for being here. Thank you for getting residents the information that they need. I want to set a backdrop for today, kind of as we close out our program. 55 years ago today was the signing of the Voting Rights Act. And as Secretary Sanders, Director Coates, and others have mentioned, here we are in another historic moment where we are pushing for voices to be heard. I looked at a photo earlier today of Reverend Ralph Abernathy and Reverend Dr. Martin Luther King looking over the shoulder of President Lyndon Johnson as he was signing the historic Voting Rights Act. And here we are 55 years later, still struggling for many of those same fundamental rights, necessities throughout our society beyond voting. It wasn't just about the ability to cast a vote. It was about the ability to be heard and to get the resources that our communities need. And so we celebrate that today. Even in the wake of the passing of our brother, our friend, Congressman John Lewis, and Reverend C.T. Vivian, but also continuing the work of this administration, continuing the work, the governor, continuing the work of inclusivity for our residents and our historically underutilized businesses. And so we do this program to make sure that everyone has a voice and that everyone's opinions can be heard, but also incorporated into what the governor's mission is and into the governor's mission and activities, but also what all of our cabinet agencies are doing. From our web questions, I just want to lift up an answer. The question was transmitted: how can one volunteer for the census? And I spoke with Bob Coates a moment ago and Secretary Sanders and the staff. And so the website that you want to visit to do that is census.nc.gov. That website again is census.nc.gov. You can visit that site, and the staff can connect you with volunteer opportunities. And this question wasn't asked, but the folks may want to work for the census. And so those are the subject matter experts. They can get you over to where you need to go. Just want to highlight a few things that have were additionally mentioned earlier. One, phase 2 is extended for 5 weeks. The governor also issued an executive order last week ending alcohol sales at restaurants past 11 p.m. Churches remain exempt from the mass gathering ban. We do encourage outdoor and virtual worship. The
the mass gathering ban does include things like a family reunion. So don't think that just because it's a family reunion, but you got 1,000 people in your family, that makes it okay to get together. We still want you to be socially distanced. Remember the 3 W's: wear, wait, and wash. Finally, in a moment where we are both confronted with the pandemic and a weather crisis, I want us all to be thinking about and praying for the residents along our eastern seaboard. The governor today is traveling to see more directly affected areas. We were in Bertie County yesterday and had the unfortunate opportunity, also very blessed opportunity to go and meet and speak with people on the Morning Road, in the Morning Road community and in the Cedar Landing community. And we want to lift up those folks in Bertie County. We want to lift up the folks down in Brunswick County, down in New Hanover County, all of the folks that were directly affected, not only in North Carolina, but along the entire eastern seaboard. In this situation, it's not the hurricane that caused so much damage, but it was the tornado. And if you think about it, that is quite parallel to what this pandemic has done. The pandemic was problematic enough, but it was the offshooting storms, the offshooting racism, inequality, and oppression that has harmed so many communities. And so we're keeping the folks that are in Bertie County and along the eastern seaboard in our thoughts, in our prayers, and in our deeds. Emergency management at the state level is working with the local emergency management to get folks the things that they need. I'd ask that as you're sending in requests, as you're sending in opportunities, are things that you'd like to see us do. Also, if you'd like to volunteer, or if you'd like to make a donation, or if you'd like to chime in and lend your time, talent, and treasure to that area, make sure to visit our website, volunteernc.org, and also sign up and let Caroline Farmer and the team know how you can help. Finally, thank you all for being committed to what we're doing. We'll likely do another one of these programs just before our next major announcement. We appreciate all your help and all your partnership, and we look forward to working with you in the weeks to come. Stay safe, wear your face mask, wash your hands, and wait 6 feet apart. Y'all have a good day.